Hello, Biology 54. My topic is digestive disorders, and today I'll be presenting on gastroesophageal reflux disorder and its treatments. Gastroesophageal reflux disorder, or GERD, is a disorder in which the lower esophageal sphincter, located at the top of the stomach, is too weak or relaxes at inappropriate times, allowing stomach contents to flow back up into the esophagus, causing moderate to severe irritation. As you can see in the diagram, the pressure from the stomach is more than the lower esophageal sphincter, or LES, can handle, and the stomach contents flow back upwards into the esophagus. GERD is extremely common, one of the most common outpatient diagnoses in the United States. 60% of adults experience at least one episode per year, with 30% having weekly symptoms. Although lifestyle and diet are not the only factors that contribute to GERD, they do play a role. Individuals who are pregnant, obese, or frequent smokers are at higher risk for GERD than others. Another factor is diet. Although the foods change from person to person, there are some that are universally irritating. These include chocolate, peppermint, caffeine, alcohol, and fried or fatty foods. Even foods that are best for GERD, if overeaten, will also cause symptoms and irritation. Another surprising fact is that even things as simple as wearing tight clothing around your midsection can cause and contribute to existing GERD symptoms. Another alarming statistic from 2005 is that hospitalizations since 1998 from GERD-related issues have increased by 216%. And because of the number of people that are overweight and obese have increased, this number has also only increased. In the stomach, there are special cells in the mucosa layer that secrete mucus in order to protect the stomach from the very corrosive hydrochloric acid used to digest food. However, because acid is never supposed to reach the esophagus does not have the same mucus lining, and therefore is much more susceptible to irritation by the acid. Next up is symptoms. The most recognizable symptom of heartburn is the painful burning sensation in the throat and chest that occurs when stomach acid comes into contact with the tissues of the esophagus. Other symptoms that commonly accompany GERD include dry mouth, gum irritation, and sometimes gum bleeding, chronic cough, tooth erosion, and pain or swelling in the throat. Another rare symptom that only occurs in 1% of cases is called Barrett's esophagus. In this disorder, the tissues that line the esophagus change to resemble that of the lining of the intestine due to acid exposure, and although it is not harmful on its own, it has the potential to develop into esophageal cancer, which can be fatal. All of these symptoms are caused by the tissues reacting to the acid. None of these tissues are equipped to come into contact with the very corrosive hydrochloric acid of the stomach. When reflux comes into your esophagus, some of it stays there, and as you breathe, you inhale bits of food and acid. This contributes to the cough. Because of this, GERD is also commonly linked with some sort of mild asthma. When it comes to treatment options, you can choose between medicinal and surgical. The first is medicinal. The first group of medications are antacids. Antacids work by counteracting and neutralizing the stomach acid so that it no longer irritates or damages the tissues in the esophagus. Common antacids include Alka-Seltzer, milk of magnesia, Maalox, Melanta, Pepto-Bismol, and Tums. The second group of medications are called acid reducers or acid blockers. Acid reducers work by inhibiting the production of acid in the stomach so that the base level of the stomach is less acidic. Even if there are cases of reflux, the damage is again limited. Some common acid blockers include Pepcid, Tagamet, Zantac, Prilosec, and Prevacid. The final medication group is the promotility group. Promotility agents work by stimulating the gastrointestinal tract. This causes stomach contents to move out of the stomach and into the lower GI tract faster, which takes the strain off of the LES and moves the acid away from the esophagus. Even though these medications are the most widely used treatment technique and are relatively effective, they can cause serious side effects like headache, abdominal pain, diarrhea, nausea, gas, sore throat, runny nose, and dizziness. If the pharmacological options aren't aggressive enough, there are also a couple of surgical options. The first option is fundoplication. The fundoplication procedure is relatively simple. They make an incision in your chest, then gather some of the top portion of your stomach and wrap it around your lower esophageal sphincter. This increases the strength of the LES and makes it much more difficult for stomach contents to flow backwards. Although this is a viable treatment, it includes a risk, like any other surgery, and requires recovery time. The second surgical option is the newest treatment technique of the ones I have discussed, and is called stretotherapy. Before the procedure, a flexible tube tipped with a camera is inserted down the throat. Once the depth and severity of the damage has been assessed, the camera is removed and a guide wire is inserted. The doctor then slides an inflatable catheter equipped with hooked needles down the throat. Once it is at the proper depth, the balloon is expanded and the needles are inserted to the tissue. Once the needles are in, they're heated to 85 degrees Celsius for 60 seconds. This causes the cells that they are in contact with to die and form scar tissue. The balloon is then deflated and the hooks are repositioned, and the process is repeated multiple times. The accumulation of scarred cells thickens the tissue at the bottom of the esophagus near the LES and provides reinforcement and strengthening for the LES. This effectively reduces volume and severity of reflux episodes, and subsequently the secondary symptoms of GERD. The images on the right show before, during, and after pictures of the stretotherapy. In the first image, it shows the stomach contents flowing back up through the esophagus. Each highlighted dot in the second image represents an area where the needles would pierce the tissue and burn the skin. And as you can see, there are 6 rows where this has been done. This means that the tube was moved 6 different times and there were 6 different sessions where the hooks were heated. In the third image, you can see just how much the stretotherapy has thickened the tissue, and can also see that the stomach contents no longer have backflow. Because gastroesophageal reflux disease is such a common occurrence, affecting over 1 in 10 people in the Western world, effective management of it is very important. GERD is also caused by obesity, which is trending upward, so the amount of those suffering will only increase. Because GERD isn't going away, it's worthwhile to explore treatment options and further the research in existing treatments. The current most common treatment of GERD relies on the use of proton pump inhibitors, which cause a myriad of side effects over time, and the other leading treatment, the fundoplication, requires surgery and an extended recovery period, which adds extra risk. Stretotherapy seems to be a promising treatment, both effective and minimally invasive, that could replace both of these other procedures. It has even been successful in cases that it was used on children and infants, and as of yet has yielded no long-term negative effects. I believe that stretotherapy and techniques like it should be researched so that we can more effectively treat the millions of people that have and will have gastroesophageal reflux disease. Thank you for watching my presentation, and I look forward to seeing some of yours.